Welcome to our lecture on sleep disorders. The first is insomnia. This is typically when you have a difficulty getting to sleep or staying asleep. There's also temporary insomnia, which is often caused by worry, stress, or even excitement. There's drug dependency insomnia, which is caused by a withdrawal from sleeping pills. So you're taking sleeping pills in order to sleep, and now you've stopped. So this drug dependency insomnia often kicks in. There are some behavioral remedies for insomnia. Alcohol and other depressants may help a person get to sleep, but actually reduce the quality of sleep. And the same often goes for sleeping pills as well. This is best to treat with lifestyle changes as well as behavioral techniques. So stimulus control, sleep restriction, relaxation, exercise, the type of food that's put into the body, stimulant avoidance often help lower the symptoms of insomnia. Sleep terrors. This is when a person suffers panic and may even hallucinate this sort of frightening dream images, and it often happens in the bedroom. So you're hallucinating that something is in your bedroom, in the room that you're currently sleeping in. Sleep terrors are times of screaming, crying, and intense fear, and sometimes waving of arms and legs, and they're not fully awake yet. Sleep terrors are a type of parasomnia, um, and these type of parasomnias are often, disrupting or strange behaviors or experiences during sleep, often during REM sleep. And a sleep terror usually lasts from a few seconds up to a few minutes, but can last longer, but typically it's in that range. And a person who has a sleep terror remains asleep during this episode. Children usually don't remember anything about their sleep terror once they wake up. However, adults often recall parts of the dream that they had during that sleep terror. And during a sleep terror, a person may start by screaming, shouting, or crying, sit up in bed, look scared, stare wide-eyed, sweat, breathe heavily, and have a racing pulse, a flushed face, or even enlarged pupils. They often kick or thrash, and they are hard to wake up and often seem confused once they're awakened. It is not easy to comfort or soothe someone having a night terror, so often they seem very uncomfortable or just uneasy. They have little or no memory of the event the next morning. That's typically in children. Adults don't remember the full dream often, but they will remember like a snippet or the fact that they had terror or that something was bothering them in their dream. There is a possibility of them getting up out of bed, running around the house, or even having an aggressive behavior, especially if held back or trying to be blocked. That does tend to have an aggressive response to it. Another one is sleep apnea. This is actually fairly common, but sleep apnea is a potentially serious sleep disorder. This is where your breathing repeatedly stops and starts during sleep. If you snore loudly and feel very tired, even after a full night of sleep, the main uh, types of sleep apnea are OSA or obstructive sleep apnea, which is the more common form. This occurs when the throat muscles relax and block the flow of air into the lungs. There's central sleep apnea or CSA, and this occurs when the brain doesn't send proper messages to the muscles that control breathing. And then treatment emergent central sleep apnea, or this is known as complex sleep apnea. And this happens when someone has OSA diagnosed with a sleep study that converts to CSA when receiving the therapy for their OSA. Some of the symptoms are loud snoring, episodes in which you stop breathing during your sleep, which would be often reported by another person, gasping for air during sleep, awakening with a very dry mouth, very bad morning headache, difficulty staying asleep or insomnia, excessive daytime sleepiness. So throughout the day, you're just very tired, difficult paying attention while awake, and often being very irrational or even angry. The last one we'll talk about is narcolepsy. This is a sleep disorder that makes people very drowsy during the day. People with narcolepsy find it hard to stay awake for a long period of time. They often fall asleep very suddenly. This can cause issues in their daily routines, their daily lives. Narcolepsy is a lifelong condition for which there is no cure. However, medications and lifestyle changes can help manage the symptoms. Some symptoms are excessive daytime sleeping, sudden loss of muscle tone, sleep paralysis, hallucinations, and a drastic change in REM sleep. I hope you've enjoyed this lecture.